Hi, I'm Larry Micarenda. Welcome to this edition of Excelsior Forum Profiles. With us today in our continuing series is Dr. Sanjay Godhwani, rheumatologist. Great to have you back again.
Larry, always a pleasure to be back on the show. Thanks for having me, man.
So many questions. A lot of people coming down with a lot of arthritis. It's been a horrible winter. 50 degrees one day, minus 15 the next.
You can't make it up. Don't ask the weather, man.
Yeah, people's joints are killing them. And when people's joints kill them, that's where they call you.
Right.
And one of the things we're going to discuss today is that some people who have the disease probably already know about, but some people who don't may not, and that is gout. Now, what is gout exactly?
You know, I think this is a really good topic to discuss for our audience. Gout is what we consider a crystalline arthritis. So it's a group of conditions, it's one of a group of conditions where your body produces uric acid. And everybody has uric acid. You have it, I have it. However, this pool that exists of uric acid then starts to deposit into joints. And it causes this severe pain, severe swelling. So gout is a disease of uric acid buildup, and it could be permanent and can cause permanent damage if it continues to progress.
Now, what some people don't understand is when you said crystalline,
Right.
what these things basically look at, and you had shown me a picture,
Right.
we'll bring that picture up. These things look like spears or spikes. And when they get into the joint,
Right.
it's just horrible. Now, there's also another type of gout called pseudogout.
Correct.
Where the spikes they're oval, they're
Right.
round, which
Yeah.
is, and
They're
this all comes from uric acid?
Right, so that's a great point that we made here. So the uric acid crystals are needle-shaped crystals, like spears, but they're called needle-shaped crystals. And that's the disease that's associated with gout. And sometimes people will say pseudo-gout because it looks like gout, it sounds like gout, it smells like gout. However, the crystals that are involved with that are more rhomboid-shaped or like a diagonally square-shaped. And that's the term that's used for pseudo-gout. And that's why these conditions are classified as a part of these crystals or crystalline arthritis.
Now, how does someone get gout?
Yeah, so you know, I really like this example that I use for describing gout. And what happens with gout, I tell people to pretend we're looking at like a Brita filter. And the way you get gout is when this filter overflows. So your body overflows with gout like the same way this water would overflow in this Brita filter. So the two ways that people get gout are either you're consuming too much, so you're taking too much in. So you take this Brita filter, you stick it under the water faucet, and you keep it running. Of course, at some point, it's not going to be able to filter enough water, and that water is going to overflow. And that's one way of getting gout, where you've eaten too much, you've taken too much in, and now it's produced a higher threshold than your kidneys can filter. The second way that people can get gout is what if the filter is not working? So now I'm putting it only a little bit of water into the Brita cup, Brita filter, but I put duct tape around the filter itself. So now even though there's not enough going in, there's not enough being cleared. So the second way that this jug can overflow or your body can overflow with uric acid is essentially if the filter is blocked. So one way again is you're eating too much, consuming foods and things that can cause a lot of uric acid. And the second part is if your kidneys aren't working and if the filter is damaged or not working, and that can also lead to gout. In most people, it's either a combination of two, but those are the two main factors.
Now, the terminology that's used, most people would say it hurts, it's an episode. Rheumatologists call it flares. When you get a gout flare, how do you know it's gout?
Yeah, great question. For some reason or another, it usually starts in the middle of the night. People typically wake up first thing in the morning, and it's so painful that even a sheet, an article of clothing, your bed sheet would hurt. We call it flares because it's episodic. People don't have just continuous gout. It comes, you treat it, it resolves. However, the flare comes when either somebody's consumed an excessive amount, something has changed, things can trigger it. So when that happens, we call it a flare. Typically, gout is seen in the big toe, and that's called podagra. And that's where the big first toe is swollen, red, painful. And it's very, very tender, very tender.
But also, it can attack the other joints, such as the knee, right?
Yeah.
We had spoke about that earlier.
Yeah, so the body with gout usually favors gravity, and it's usually cooler extremities, so it's mostly in the feet, it's mostly in the lower extremities, and it can be in the elbows, the knees, the wrists. It's usually not in the hips or in the shoulders, not saying that it can't happen in those areas, but typically gout favors gravity and it also favors cooler environments.
Now, you mentioned before about foods that you eat. We know that excessive alcohol consumption is a big
Correct,
baddie.
absolutely.
Because beer and a lot of the alcohol is very high in what they call as purines.
Correct.
And the purines turn into uric acid in your body. Your body changes it again
Absolutely.
somehow, and then it stores up. Body can't get rid of it. Like you said, the filter gets clogged. Everything
Right.
starts backing up.
Right.
Now, what are some of the foods that are good for gout, and what medications can you use?
Yeah, so that's an excellent point about alcohol, and just so the audience knows, beer is worse than hard liquor, and that's worse than wine and other drinks. So alcohol is the most likely culprit. And like you said, it's more of this purine imbalance that leads to more uric acid production. Other foods that can trigger gout that are not good to eat for people who have gout are red meats, shellfish, seafoods, particularly shellfish, uncooked meats, red meats, and also sugary drinks. Believe it or not, I'll ask patients, do you drink alcohol? They're like, no, I don't. Do you eat red meats? Do you eat seafood? Do you eat shellfish? No, 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 no. Then you dig a little bit more and you tend to find out that they're having 4 or 5 ginger ales a day with high fructose syrup. So if you're getting recurrent attacks of gout, you do want to check the back label and see if it says fructose syrup, and that's also a trigger for gout.
Because that raises, again, the purine
Right.
level and everything
Yeah.
like that. Although we're not saying that all red meat is bad, or all meat is
Everything's got to be in balance.
right. Everything has to be in
Everything's gotta be in
moderation, just like with
yeah.
alcohol or anything
Right.
else. But what are some of the medications that people could take for some gout attacks?
So, gout's broken up into 2 parts. And I think this is really important because some medications, believe it or not, are used to treat just the acute attack, that painful, red, swelling, angry looking toe or knee. And then there's medications, because if you're getting this again and again, essentially what's happening is your body is damaging that joint. When those needles attack the joint, even though it cools down, it can happen again and again in the toes, and ultimately you can get damage on your x-rays, permanent damage, erosions. Some radiologists would read it as rat bite erosions. It looks like somebody actually took a bite out of your bone, and these are permanent things. And gout needs to be considered as an inflammatory or as an erosive arthritis because it is eroding the joints. And it does cause for attention because about, almost 8 to 10 million people suffer from gout a year. Although we're doing great with coming out with medications for other kinds of arthritis like rheumatoid, gout's also episodic. So people take medications for that acute flare and it gets better. However, they don't realize that, look, this has happened 3-4 times this year. What's it doing to my joints? So some medications are used to treat the acute flare, to make that acute inflammation go away. Things like anti-inflammatories, like indomethacin, naproxen, Aleve. Steroids will work great in a short period of time, very, very fast. Colchicine is also available to use for acute attacks, and these medications will help resolve that pain immediately. However, there are long-term medications that someone has to use to lower the uric acid level. And the key point here is as you're lowering that uric acid level in your body, that uric acid has to go somewhere.
Right.
Humans don't have the enzyme to convert uric acid into a dissolvable form. So when this is happening, you're going to get attacks. So I get this quite often, doc, my physician put me on a medication, but I got attacks from it. So in the initial stages, you have to use a long-term medication like allopurinol, Uloric, alongside these other acute treatments till the uric acid is low enough, and then you can stay on just the long-term medication.
And there would also be a follow-up that I know that you do as well as the other rheumatologists is the first thing you do is you get them for a blood test,
Right.
check the kidney function.
Right.
If a person is
Exactly.
having
Absolutely
a
right.
bad kidney problem, okay, which if they don't eat no red meat, drink nothing, eat crackers all day,
Yeah.
okay, and they're still having this problem,
Right.
it could be that there's a kidney disease, a kidney infection,
Yeah.
or something like that, and that makes it much more serious and everything. However, though, if the infection or the kidneys can clear up, then odds are once the filter is working again, like you said,
Right.
that would probably, help it out.
You
with
know,
a
Larry,
cure.
you actually bring up a great point, which I didn't think about prior to the show, is blood test. And the key thing about blood tests here is that sometimes patients will have like that classic attack of gout, and they'll go for a blood test, and the uric acid level will be normal. And then they'll say, no, it's not gout. The key thing that we need to also take away is that when you have an acute attack of gout, the uric acid level will be low in your bloodstream because it's likely in your toe.
Yeah.
So it's not recommended to diagnose someone based on a blood test.
Right.
Because the most definitive way, like you said, is to look for those needles. So putting in, draining out the joint, looking at the fluid, and finding crystals is the definitive diagnosis for gout.
Now, you had mentioned in the past, I think it was called synovial
Right.
fluid.
Yeah.
I got that one right.
That is right.
And it will, when it goes into the lab and it's stained, these things show up like, like a
Yeah,
motion
we
picture.
examine them under the microscope. You
Yeah.
know. Next
So-
time I'll bring you some synovial fluid. We'll look at it live on TV.
I'm looking forward to it.
You know.
The next subject I had for you is a disease we're hearing a lot more about.
Right.
And it was prevalent in the 50s, 60s. It was misdiagnosed. It was called
Right,
something different.
right.
It's fibromyalgia.
Right.
And from what we hear is that a lot of women get this, more women than men.
Mm-hmm.
Could you tell us a little bit about fibromyalgia and what it is?
Yeah, and I think, we're discussing a lot of key topics here, and fibromyalgia has been around for many, many years, like you mentioned, and it's creating a lot of buzz. A lot of patients don't really know what it is, and it has so many different presentations. We're not really sure what it is or what's going on, and it tends to cause a lot of stress. You are absolutely right. Women do get fibromyalgia more than men, but men get it as well. So what is fibromyalgia? What is it? It's a condition where you have widespread pain, and it's associated with a multi-symptomatic condition where it can be a head-to-toe condition where you can get headaches, migraines, you can have jaw pain. A lot of people find a foggy sensation. It's called fibrofog or brain fog. So you can present with a lot of different things, and the key thing here before we go into more about what it is and what the signs and symptoms are is that it's not an autoimmune disease. Fibromyalgia is not a condition that will affect your joints permanently. It's not a muscle disease, and there's no inflammation associated with it.
Now, part of the word is fibro, so you're thinking fibrous.
Mm-hmm.
So is this the nervous system that fibromyalgia really attacks? Because you said
Yeah.
it can also affect the other organs. You were
Yeah,
saying before.
absolutely. So it is considered to be an imbalance between some neurological chemicals, and more study has been going into it now where it is coming out to be more of a sensory kind of disease where it does affect some of the fibers in the skin. So a lot of studies are going into it and finding out what it is. Essentially what happens is your sensitivity to pain is drastically heightened. Now what does that mean? Now of course if we step on a nail we're going to scream and touch and say ouch. However, even stepping on a carpet or hugging someone, doing things that wouldn't normally cause people pain.
Extreme sensitivity.
Extreme sensitivity. That sensitivity is heightened. And the reason for that heightening is, again, this connection with the nervous system. Because what happens when we touch something, right? Like, let's say we touch a boiling pot of water. The first signal is this boiling pot. So you're looking at
Right.
it, you're touching it. I don't know why you would do that. But let's say you touch it. That signal carries up to your brain. That's the ascending pathway up to the brain. And then your response back down is the descending pathway.
Right. Pull away.
And that's pull away.
Right.
What are you doing,
Now, I had spoke to a patient who actually had fibromyalgia, and they used the same incident. They said that if you ever got a heat blister, burn
Right.
your hand or something like that, and you feel, you know how sensitive your skin
Yeah.
is, she said, try to picture that on your whole entire body.
Right, right.
So there's like sometimes they're in pain just wearing clothing.
Correct.
I mean, it's just really incredible. It's like sensory overload on the nervous system.
Yeah, and that's really the best way to describe it, sensory overload, you know, and sometimes they'll say the terms, people will feel like my body's bruised, like I have black and blues everywhere. I feel like I just got hit by a truck. I'm so tired, fatigued. All of my joints hurt. My skin hurts. My hair hurts. They do have instances with migraines, restless leg syndrome, abdominal discomfort like irritable bowel syndromes. Sometimes it can even cause like cystitis or urinary changes. So a lot of things can occur with it, but who gets it? Like, you know, why do we get this? And the key is, like you mentioned, it could be a part of a neurological condition, maybe an underlying condition that's associated. There is also genetic factors that play a role. And then sometimes in trauma or an enticing event, something that's very, very hard on people, like a bad accident, you know, or a really bad infection. They got sepsis, they ended up in the hospital, had complications.
And some of the treatments that are out there now are getting pretty amazing for fibromyalgia. Because originally it was taking something to dull the nerves, okay, which led into other complications. But
Yeah.
a lot of times, yeah, people say medication's just a trade-off. You're trading one thing, one
Right,
pain
right.
for another. But now the use of electronics, TENS units and beyond now for some of these things, because you know our whole body runs on electricity. That's what
Right,
your
yeah,
nervous
yeah,
system
yeah.
is. So they're working on right now some of the state-of-the-art things with the TENS unit and stuff like that. Are there some other treatments that are available for people with fibromyalgia?
Because the key is really just to be able to diagnose fibromyalgia. Like we mentioned before, there's a lot of conditions, you know, underlying malignancies, autoimmune diseases, arthritises. First thing we have to understand is that fibromyalgia is, by itself, it's a very, very small percentage. It's usually in conjunction with another major condition or disease. So the first step is to diagnose it. And then, yeah, you know, at our practice, we don't tend to just say, okay, medications, medications, medications,
Right.
because the treatment is really, it's mind, it's body, and it's also about your mindset. You know, it's about your diet, your nutrition, your overall wellness. So we can target all of these things together.
Or heart and soul, as you would say
Heart and
sometimes,
soul.
right? But now with fibromyalgia, the big thing that you have as far as diagnostic tools is that it's a tricky little devil
Right.
because it mimics so many other diseases.
Absolutely.
Arthritis, psoriatic arthritis, which we spoke about
Right,
last time.
right.
All these can be fibromyalgia, or they could be something else. So that's why the diagnostics are so
Yeah, so
important.
fibromyalgia is termed a disease of exclusion. So we do have to rule out certain conditions, like looking for any type of inflammation markers, muscle tests, thyroid diseases. So we do rule out quite a bit. And then we do have to try to see if some of the treatment options would be working or would help.
So Dr. Godhwani, can you give us a quick summary of what we just spoke about with fibromyalgia and gout?
Yeah, absolutely, Larry. First of all, I think it's great that we're doing education for our patients again and for our viewers. So the summary thing about gout that we want to realize are what triggers it. So the foods and nutrition, which we're going to talk about a little bit more with Kyle. We also talked about the conditions that are associated with gout and what joints are commonly affected. The key thing to understand is gout is treated in that acute flare, that painful, very, very sharp, stabbing, redness, pain that's treated with steroids, anti-inflammatories, or sometimes colchicine, and then the long-term management for gout. Again, there's a balance of what we're taking in that's very, very important, and also an issue with our filtration devices, which is our kidneys. So a component of all of these things will play a role in gout. The main thing is to recognize also that once the attacks are occurring over and over again, there could be permanent damage to joints. So if you do have gout and are suffering from gout, it is important to talk to your primary care provider and ask for help and get treatment for it as soon as you can. And then the final thing I'd like to say about fibromyalgia, I know a lot of you hear about it, know about it, or have a friend or a relative who may be suffering from fibromyalgia. The key thing that we want to point out there is it's usually associated with another condition, an autoimmune disease, a malignancy, a chronic infection, trauma. There is something that's happened to our body for us to feel this way. The good news is that it's not going to permanently affect your joints or permanently affect your skin and organs. It is difficult to deal with. It is hard to live with. But I do feel confident with the right care, a good mindset, wellness, nutrition, diet, exercise, all of these things together will make a positive impact, and our patients are going to feel a lot better with it.
So lifestyle changes is definitely a big part of recovery.
Lifestyle change is a big part of recovery, and mindset. If you think positive, good things will happen. And I think this is a positive event that we're doing here. I'm looking forward to hearing comments from our viewers. If there's something else that they want to hear about or talk about, I'd love to come back and do another show with you, Larry.
Well, that'll be great. I would love that. And right now we're going to go to a quick ad, and then we'll be back with his PA. We're back, and we're back with Kyle Eskridge, who is a physician assistant who works with Dr. Godhwani. Thanks for coming on and giving us some time. Can you tell us a little bit about yourself?
Yeah, first of all, thanks for having me. My name is Kyle Eskridge. I'm from Long Island. A little bit about me, my background. I went to Farmingdale State University for my undergrad. I had a bioscience degree. After that, I went to Toro College to pursue my physician assistant degree. I'm currently a board-certified physician assistant working with Dr. Godhwani.
And what is your role in Dr. Godhwani's office?
So first of all, at Dr. Godhwani's office, we work as a team. My role specifically at Dr. Godhwani's office, I help manage patients, I help treat patients, I help diagnose patients, and I provide a continuity of care at Dr. Godhwani's office.
If you want to elaborate a little bit on what Dr. Godhwani was saying previously, some of these anti-inflammatory foods, what are they?
So the anti-inflammatory foods overall would be like the fruits, the vegetables, the lean proteins like lean fish, lean meat, some like honey, things like that. Also the non-seed spices like turmeric and curcumin. People don't know how much of an important role diet plays in your autoimmune processes, and the bad diets that you have that with the pro-inflammatory foods can lead to increase in inflammation and flares. So a diet full of the anti-inflammatory foods that we just discussed would help going forward and having a balanced, healthy life.
Now, we had also spoke about purines and purine levels. There are certain foods that are really high in purines, but a lot of people eat them and they never have a problem. Other people will have 1 ounce of it and they get a gout attack. Is there anything that these people can do, or what are like super high purine foods? If we could just go over that again.
So those super high purine foods are going to be those red meats, the alcohols, like you said, the shellfishes, those things that are high in purines. If you do them too much, like in moderation might be okay as well, but anything in too much could cause those attacks, like we had said earlier.
Now, with some of these anti-inflammatory foods, and you said about the turmeric before. Now, is this just powdered? Does it have to be like a fresh thing, or?
So it can come in different ways. You can definitely get it as a supplement over the counter. It actually comes in turmeric and curcumin together in the same supplement. So if you were trying those new spices, that would be one that would you would kind of opt for going forward.
So if you didn't want it in your food, you'd be able to take it in a capsule.
Of course.
This would help with some of the, inflammatory diseases that we were talking about previously.
Yeah, so like I said, if you implement those foods into your diet on a daily basis, like everything, balance is key going forward with the diet choices. If you implement these foods, you will feel, and me and Dr. Godhwani have noticed that patients feel drastically different when they make these good diet choices.
Now, of course, you don't work alone in the office. There are other people that work with you. Who are some of the other people that work?
Yeah, so we have a great flow at the office. We have great people working for us. We have Jackie there, we have Georgette, we have Ashley, we have Lisa. Everybody really does work together, and I feel like it provides better patient care, and we have the best working for us.
So it's best care anywhere?
No doubt about it.
Well, I want to thank you for being on the program with us, and we hope to see you back again in the future.
Appreciate it. Thank you for having me.
Okay. Until next time, I'm Larry Mike Arenda for this edition of Excelsior Forum and Profiles. We'll see you right back here. Stay tuned and stay healthy.
Hi, this is Dr. Sanjay Godhwani, board-certified rheumatologist. Looking forward to hearing any of your questions or concerns. Please give us a call at 631-886-2844 or visit our website, www.islandrheumatology.com. Thanks a lot.